talk loud enough, you probably can hear me without using that. And I just jotted a few notes down here because I wanted to make sure I didn't forget anything. Not that this is going to be lengthy, but you know, again, we appreciate you all showing up tonight and really take this as a show of support for what we're trying to do here. And we want to give a special welcome to our special guests here. We have some senior, now retired members of the staff here that have made tremendous contributions to the community. Dr. John Leffler, one of our really excellent neurologists for many years here in the community, that was a personal friend of Dr. Darroch. I see Dr. Bob Burns, one of our orthopedic surgeons for many years here in the community, that also provided really excellent long service here in the community. We appreciate him and we're glad to see him here tonight. You know, we can't say enough how much we appreciate the support that we've received from our new CEO, Warren Kirk, who really has helped to make this possible. And I know he's had an impact on many people here and really on the community in large. When I came here in 1990, which by the way was one of the reasons I came here was because Dr. Darroch was instrumental in recruiting me to come here with Dr. Lou Nelson. You know, I didn't know what to expect. I grew up in Southern California. I was in practice for a year in New England after I finished my residency. And you know, after I had to go out and shovel 2 feet of snow off of my driveway in April, after being in practice for a year, I said to my wife, you know, that's it, I'm done with snow and bad weather. I need to go back to California, you know, that's my home. So when we started to look around for opportunities, it looked like there was a real opportunity here in Modesto in the Central Valley. And after meeting Dr. Darroch and Dr. Nelson, you know, I decided to throw in and come here, and I haven't been sorry. And I really appreciate that interaction with Dr. Darroch, and I remember just meeting him and his encouragement. What a positive gentleman he was, warm and friendly and a great sense of humor. So obviously he's had a great deal of influence on many people here and just indirectly on the really good service and quality of care in this community that's become a standard. And so we appreciate that. And we thought for that reason, this was really appropriate, that he was the first pioneer neurosurgeon in our community in 1965 after he finished his residency and came over here and started something that really has led this to be a center of excellence for neurosurgical care and neuroscience care in the valley here. And now with the way Mr. Kirk has turned the facility around and really made it once again a facility where physicians want to come and practice, surgeons want to come and bring their cases. After the dark ages that it went through there for a while without good leadership, it's really a place now where we have this opportunity. And thanks to him and his support, we see that we're really on the cusp now for the first time building this neuroscience center that we've wanted to do for many, many years. And we're finally going to be able to do this. Now, we're just at the beginning, so we don't want to give you the misconception that we're up and running and ready to go and provide all the services that we hope to. But we're optimistic that by the end of this year, we're going to, under one roof, have interventional pain management, along with neurosurgery and neurology. And then we don't know if we're going to be permanently in this location or not. We may move to another location closer to the hospital, but we're looking at several different options. But our goal is to have interventional neuroradiology, neuro-oncology with our own linear accelerator where we can nuke these bad tumors in the brain and spine, and whatever other important adjunctive services that will allow us to provide, if you will, the Mayo Clinic model, one-stop shopping for our patients where they can come in quickly, effectively get evaluated, diagnosed, and properly treated, whether that be with surgery or non-surgical conservative methods, whatever's in their best interest. Because right now, that care has been fragmented for years in this community. When we see people that are in need of quick care, we can evaluate them and make a recommendation, but then the care is fragmented. They have to go somewhere else sometimes for further evaluation and treatment, and sometimes it's months before they can come back and we can discuss a surgical option with them. And in the meantime, they're suffering in pain. They become drug addicted sometimes, they lose their jobs. Sometimes their families break up, things fall apart in their life, they become depressed. It's terrible. So for the first time, we're really anticipating, with this great support that we've had and the expertise that we have with my partners here, to really provide that kind of care that heretofore we haven't seen anywhere in the valley and doesn't exist anywhere right now between the Grapevine, over the Grapevine, into the Southern California Valley and into Sacramento. So we're excited to have you all here tonight, and we'll be from time to time updating you as we have these services available, but under one roof. This is really our goal and objective. And as I hope you've seen, our mission statement is that what we're trying to do here is provide comprehensive patient care for neurological disorders of the brain and spine with surgical and, importantly, non-surgical treatment. So we're not just knife happy, a bunch of guys just trying to cut people open, but really try to provide whatever care is in their best interest. So we're pleased to have Mrs. John Darroch, Peggy Darroch, here with us tonight, and his daughter, Sally Darroch. And we really appreciate their effort to come down here tonight, and we're so pleased that they've given us permission to be able to use Dr. Darroch's name to name this new Brain and Spine Institute after him. And we hope this is going to make them really proud and add to his legacy. So if they would step up here, we'd appreciate you coming up here. And we appreciate so much this picture that Mrs. Darroch made available to us. And we had this framed and blown up and a dedication underneath it. We're going to hang this in the lobby so that our patients that come here will know about the gentleman that the clinic's named after.
Well, we're very proud and we're very thankful, and we thank you, Dr. Bybee, for deciding to use his name, which we're happy about. And he would be very happy as well. Thank you.
And we'd like to give you this crystal vase here with the logo and the Brain and Spine Institute name on it.
The logo is so wonderful. Thank you so much.
And we have some flowers, but we didn't put them in there, obviously. So but yeah, we hope you like that.
It is happy.